Welcome to Module 1 of Centering the Public Interest in Integrated Data System Analytics. So how do we center the interest of the public when analyzing data if we don't consult with the public, especially with stakeholders whose experiences are represented in that data? We are at the starting line of a journey where you will become familiar with a framework that aims to do just that. FAIR2 is a framework for integrating community knowledge in data analytics and addressing discrimination bias. It is a way to tap on the experiential knowledge that community members hold in order to inform data analytics in ways that reduce bias. Increasingly, we see that data technologies such as algorithms are used to aid in decision-making within the health and human service sector. These technologies are used to make important decisions such as who is prioritized for homeless services, what calls are screened in for child welfare investigations, decisions in healthcare, the criminal justice system, and others. In the headlines shown here, we see that these data technologies have a potential for good, sometimes, but also a potential for perpetuating discrimination bias. So data and metadata, which is the way we understand and describe the data, are increasingly more and more relevant in the way that these important decisions and service allocations are made. How then do we ensure that metadata and data analytics account for the experiences of those represented in that data and avoid perpetuating discrimination bias? One way to do this is to do the data analytics within an ethical framework such as FAIR2. FAIR2 builds on a previous set of ethical standards for data called FAIR, which stands for Findable, Accessible, Interoperable, and Reusable. FAIR2 takes the FAIR principles a step further by adding 4 more principles specifically for use with social data. And this is, of course, if we aim to serve the public interest. So in FAIR2, the F stands for framing the metadata with contextual and experiential knowledge. The A is for articulating assumptions into system graphs, causal graphs, making those assumptions explicit. I is for identifying and addressing bias in data analytics, and R is for reporting findings to community stakeholders and seeking feedback from them. In this way, FAIR2 is a framework for public interest technology in data analytics. And if you'd like to learn more about FAIR2, you can click on the link below on your slides, visit the website where we have more information on FAIR2. So why FAIR2? Here's an example that illustrates why we need a framework like FAIR2. It is based on the study Dissecting Racial Bias in an Algorithm Used to Manage the Health of Populations by Obermeyer and co-authors in 2019. The study documents that a major health system aimed to identify patients with the most health complex needs to enroll them in a specialized care management program. Analysts developed an algorithm that used total healthcare cost as a proxy for medical need. So again, total healthcare cost was a proxy for medical need. They assumed that the more a person spends on healthcare, the worse their health condition is. This algorithm did not use race as a variable as a way to make it unbiased. However, it was later shown that the algorithm was racially biased against African American patients. For the same data-derived risk score that the algorithm produced, African American patients had more severe diabetes, kidney failure, and other risk conditions as compared to white patients. This meant that the specialized care management allocation would disfavor Black patients relative to white patients with the same level of healthcare need. So data most likely agreed with standard FAIR principles. It was findable, the data was accessible, interoperable, and reusable. But how did bias arise then? Well, structural inequalities, lower access to care, and bias in health care delivery meant that the system historically spent less on Black patients. Under the FAIR2 framework, experiential knowledge of patients would have clarified that cost data are not a good reflection of health status for patients that have been historically marginalized. So FAIR2 draws from work by scholars and activists calling for better data science in the early 1900s and today. So these include prominent figures such as Fannie B. Williams, W.E.B. Du Bois, Kelly Miller, and Ida B. Wells, among others that were not listed here. These activists and scholars noted that data do not speak for themselves, and that lacking logic and social context, data analytics were flawed and had been used in ways in the early 1900s that perpetuated bias and discrimination in our society. This was in response to social scientists in the early 1900s that used data without context and with bad logic to justify their discriminatory claims. The call of these scholars and activists resonates with current calls of some historians, medical scholars, and data scientists to clarify modeling assumptions with causal maps before moving to data analytics. The one graphical model shown here is from a 2022 paper by Dr. Howie and co-authors on racial disparities in COVID-19 hospitalizations. Causal maps allow us to be transparent about the assumptions we make regarding the social system underlying the data we aim to analyze. FAIR2 calls for explicitly eliciting the experiential knowledge of those represented in the data to inform those assumptions. FAIR2 recognizes and highlights that data do not speak for themselves, that observational data reflect discrimination in society, and that an explicit framework to identify and address discrimination bias, with the help of experiential knowledge, will further data science's potential to advance social justice. Now we will go through each of the principles of FAIR2 one by one. So first, the F stands for framing the metadata and data with historical context with experiential knowledge of those represented in the data. One way to do this is to conduct data chats. Data chats are guided conversations between practitioners, data analysts, researchers, and people whose experiences are represented in the data. The aim of data chats is to leverage this experiential knowledge to inform the inputs of the data analytic process or research activity that is being conducted. And so, in that way, experiential knowledge is at the very beginning of the data analytic process. Some questions that you may ask data chat participants include questions about the data intake experience, if we're talking about administrative data, for instance, for homeless services. Who entered the information you provided in the intake form for homeless services? Do you think this data is necessary to provide the appropriate services? In your experience, what would cause you to not seek homeless services even when you are in need of shelter? The experiential knowledge gained from data chats can be used to inform the research question and research activities, such as modeling and estimation, or program design and evaluation. Ultimately, it will help to inform research results in a way that situates these results in the historical and social context under which the data was generated. The A stands for articulating the general model in a causal graph. Insights gathered during data chats and the literature, sometimes a qualitative literature, can be used to build a causal model. The goal of this stage is to explicitly state model assumptions, the background knowledge, and hypotheses about the role of discrimination in the social phenomenon being studied. An example of a causal graph is shown here. It is based on the question, what causes young people to experience homelessness and shelter stay? We can see that there are many influencing factors, many of which may not be present in numerical data sets, such as historical discrimination, marginalization, stigma, and social networks. Many of these elements arise from the experiential knowledge of young people that had experienced homelessness and sat with us in a data chat. The I stands for identifying biases embedded in the data and variables of interest. So this table provides an example of identifying bias in the data used to predict homelessness risk, which may be used to prioritize services. We examine bias at 3 levels: the outcome, inputs, and study data. For the outcome, we can ask ourselves what our desired outcome is and what our measured outcome is. For example, we may want to measure the risk of being unsheltered at 6 months, but we may only be able to observe who is seen in administrative homeless service records at 6 months. Think about who may be unsheltered but not appear in homeless shelter records. These are people that we would not be able to account for in our data. For example, if someone had a negative experience with previous shelter use, they may not seek shelter at a later time, despite them needing shelter. Next, we look at bias in our choice of inputs. So we look at our desired inputs as opposed to our measured inputs. Here, we want to look at who has experienced food insecurity, for example, in the past year. However, we're only able to see who has enrolled in the SNAP program in the past year in our data. So there may be people who are experiencing food insecurity who are ineligible for SNAP benefits. We would not be able to see these folks in our data. When looking at inputs, it is also important to consider the role of variables reflecting discrimination status, such as sex, gender, race, and ethnicity. For example, are LGBTQ plus young folks more likely to feel insecure in shelter and thus less likely to apply despite their need? Finally, we want to consider how the data we utilize may fail to represent the population we care to study. For example, if we only use HMIS records, Homeless Management Information System records, to predict homelessness, we will not truly be predicting homelessness because we fail to account for individuals who do not feel safe enough to seek shelter. Lastly, different data systems may change the ways they categorize demographic variables over time. How do we aggregate and report along these different categories? It's important to systematically scan data for all these potential issues. The overall goal is to minimize bias and always report on limitations of the analysis. Be transparent about your data analysis process in your reporting. Finally, the R stands for reporting findings to and seeking feedback from community stakeholders. We have found a positive response from data chat participants when we share with them a synthesis of their insights and give them the opportunity for additional feedback. One participant said, "I'm just so glad you are all taking your time to hear our thoughts and experiences. I feel like students using this for research should not be the destination. We need to show this to people in charge." Another participant said, "Statistics are important, but I think we should spend more time emphasizing the why versus the who." And the why is what we try to incorporate into the causal graphs, with assumptions not just coming from researchers, but also from people represented in the data. Well, finally, somebody else said, I feel like people are eager to share their experience if people are willing to listen. Remember, the aim is to democratize the data analytic process, seeking feedback from community members who hold valuable knowledge and whose well-being is at stake, as well as from agencies who work to address the social issues analyzed. A framework like FAIR2 can empower social workers and others who work in the community to influence the development of data analytics for positive social change or for the public interest. To recap FAIR2, before we move on to our next module, remember that FAIR2 addresses bias in social data science, and in that way it is a framework for doing data science for the public interest, or a public interest data science framework. FAIR2, as a reminder, stands for Frame, Articulate, Identify, and Report. In Module 2, we will discuss how to apply the FAIR2 framework via data chats with individuals represented in the administrative data in order to enhance our understanding of this data, how it was generated, and what this implies for how we do data analytics with it.